I want to share with you some different positions for breastfeeding. Once you have your baby, your nurses or your lactation consultant, they're going to help you figure out exactly how to get your baby positioned. But before you get there, I just want to show you some different techniques that you can use with positioning, or maybe you're at home struggling with how to get your baby latched correctly in positions that feel comfortable for you. So when you're breastfeeding, there's several different positions you can do, and I'm just going to go through them and show you. The biggest thing I want you to think about when you're positioning your baby is you always want to keep your baby's head in alignment with their body. So I'm going to show you on our baby doll. When you or I eat our food, we don't turn our heads sideways to eat. That feels really awkward and uncomfortable. Babies are the same way. So think about if you're breastfeeding your baby and you're making them turn their head sideways to latch, it can really affect a deep latch and it can really make it uncomfortable for babies. So no matter what position your baby is in breastfeeding, you want to make sure that his head is in alignment with his body. So what this looks like, if you're doing what we call a cross cradle hold, so this is really good for newborn babies. You want to think about having them belly to your belly. Their little hand is going to be on either side of your breast. So the bottom hand is going to be tucked up under here. The top hand will be right up on top. And this hand would be holding your breast, while this hand is holding right behind their ears. So baby's head, they're like bobbleheads, especially newborns. So you want to make sure that you're controlling the back of their head for positioning right behind their ears. You don't want to be up here on the top of their head, number one, because then you're potentially smushing their head in your breast. And number two, it's really distracting for babies when they're breastfeeding to have your hand moving all over their head. So you want to make sure that your fingers are right behind their ears and you're really helping them control their head and neck. If we were in this position, the technique is to hold your breast, hold their head, and when you go to latch them, you want to think about bringing them into your breast, chin first. So as they go to latch, their chin is the first thing that touches your breast, and then they come up and over. If we did another position called a football hold, that's when babies are either flat on their back, coming up underneath to latch, or how I prefer to have babies in a football hold is more turned on their side. You'd have some pillows here helping support you, but they're turned on their side and they're able to keep their body straight in alignment for the latch. Another position could be sort of a laid back position. I can't lay all the way back in this chair, but I just want to talk you through it. In a laid back position, your baby is more on top of you. I would be a little bit more reclined, but the gist of this position is your baby is across your body and they're leaning back on you to latch. Another position for a little bit older babies is a cradle hold. With a cradle hold, instead of the cross cradle, your baby's more like this. So this position is for older babies. It's really difficult to get a newborn to latch in a cradle hold. What I see a lot of the time in the hospital setting is I'll walk in a room, a mom's trying to get a baby to latch, and she's doing the arm movement where she's going like this to get the latch. It's going to be really hard to get the deep latch in that position. You've really got to cross over and do the cross cradle hold in the first couple weeks of life. Sometimes moms will say they can't get their baby to latch on one side, and it could just be a preference and you're right-handed or left-handed and it feels more difficult or easier to latch on a certain side. But sometimes it can be what's called torticollis, and what that looks like is maybe your baby has a hard time turning their head one direction to latch. So sometimes torticollis can develop after birth if you're really helping your baby latch on just one side or you're staying in the same position with every feeding. Or it could happen in utero where your baby's kind of wedged in and their head is turned to one certain side. And then when you go to try and breastfeed, so let's say this baby had a hard time turning their head to the right, it might be harder to get them to latch here. Or it could be harder to get them to latch this way because they need to bring their head around a little bit. The most important thing you need to remember about torticollis is this. If you're worried that your baby's not latching, or if you feel like they're only able to look in one direction, or if you've tried different positions for breastfeeding and you really can't make a certain position work, you should reach out to a pediatric physical therapist for an evaluation to see if torticollis could potentially be what's going on. So the last thing I want to mention here is if you feel like you're having issues with latching and your baby was previously breastfeeding on one side and now is refusing to breastfeed on that side, or if you notice any kind of discoloration, lumps, discharge, anything like that in your breast, it's really important that you reach out to your OB provider to have an evaluation and suggestions for moving forward. 9 times out of 10, it's going to be the more common complications we see with breastfeeding, such as clogged milk ducts, mastitis, engorgement, anything like that. But it's really important to get it evaluated and make sure that it's not something more serious like breast cancer.